afternoon, everyone, and welcome to today's webinar. I'm Lisa Silverman. I am your webinar facilitator for today, and I'm joined here by my colleague, Heather Bonome. Heather's going to be facilitating most of the conversation, but I'm going to kick us off and get us started. Our webinar today is on the future of specialty pharmacy, and URAC is uniquely positioned to host this webinar because we are the leader in specialty pharmacy accreditation. You'll hear more from Heather in just a minute, but we're here because this is part of our rollout of our new white paper on the future of specialty pharmacy and the role that specialty pharmacies play in the healthcare spectrum. Heather will talk about that more towards the end of the webinar, that particular white paper, following our conversation, but we wanted to tee that up.
Sounds great. Thank you so much, Lisa. Good afternoon and welcome, everybody. I am Heather Bonome, URAC's Director of Pharmacy, and I'm so glad to be with you here today for this conversation. Thanks for joining us. I'm going to start out with just a little bit of level setting on URAC and our place in the pharmacy space, and then we're going to dive into the discussion. So as you can see on your screen, URAC is more than 30 years old, having just celebrated our 30th birthday. We are an independent accreditor, and we do not provide consulting services. And because of that, we're able to say that we keep our accreditation processes fair and completely free of bias. Next slide, Lisa. Thank you. So URAC offers a wide variety of pharmacy accreditations. And again, while we accredit across the pharmacy space, from PBMs to drug therapy management organizations to home infusion pharmacies, we are especially well known for our specialty pharmacy accreditation. We accredit many different models and sizes of specialty pharmacies, from large multi-site practices to specialty pharmacies within health systems to small independent pharmacies. And I think that was demonstrated by a lot of the participants from the poll that Lisa just shared with us. It looks like a lot of our accredited organizations have joined us today, and we're really glad. In addition to our accreditations, I do just want to highlight here on this slide too that we also offer designations in special areas for organizations like yours to show where you go above and beyond in patient care. URAC's designations, they're an add-on to either a new or an existing accreditation. And we're especially proud of our new Rare Disease Center of Excellence designation and also our Opioid Stewardship designation. We are going to be talking a bit about rare disease just in general today, so that can come into play and is pretty relevant. If you do have any questions about our accreditation programs throughout today's session, please feel free to enter them in the chat box. And we've got a whole host of URAC team members, as Lisa shared, on the line, and we'll be sure to get you connected with someone who can answer your question. All right. Again, as I mentioned before, and I'm not sure how much I have to mention in the pharmacy space, URAC is best known for our specialty accreditation. We're often referred to as the gold standard in specialty accreditation. And payers and manufacturers recognize the value of our accreditation program and often utilize that for network participation or access to limited distribution drugs. But it's really, I think, our accredited pharmacies that have helped us to achieve the level of leader in specialty pharmacy accreditation. It's our accredited pharmacies that teach us about what is important in specialty pharmacy practice. And it's these industry leaders, many of you who are accredited and have joined us today, that contribute to our program standards and continuously present us with new and innovative ways of meeting the standards. So it's my pleasure today to bring together a group of pharmacy industry experts to talk about their place in specialty pharmacy and what they expect in the future. So today's panelists, we're excited to welcome everyone here. We feel like we're uniquely positioned to bring together this group for what we hope is a thoughtful and inspiring conversation, again, about the future of specialty pharmacy. So it is my pleasure to introduce Sheila Arquette, the President and CEO of the National Association of Specialty Pharmacy, Brittany Kalekow, Infusion Nurse Manager with Heritage Biologics, Tara Kelly, the Executive Director of Specialty Pharmacy Services at Vanderbilt University Medical Center, and Amanda Walker, Chief Operating Officer at Heritage Biologics. Thank you again all so much for joining us today. So at this point, I'm going to ask Lisa to end the slideshow, and we're just gonna transition to conversation mode. I'm going to invite Sheila to turn on your camera so we can kick off our conversation about the current and future state of pharmacy. Okay, great. Hi, Sheila. I see you there.
Hi, Heather.
Thanks again for joining us.
Oh, thanks so much for inviting me.
Oh, my pleasure. My pleasure. So as the leader of the National Association of Specialty Pharmacy, or as we call you all, NASP, you have a bird's eye view of trends in the specialty pharmacy space. Can you talk about some of the biggest trends you're seeing in the practice of specialty pharmacy?
Sure, Heather. That's a really great question because as we all know, specialty pharmacy continues to evolve, right? And it's very fast paced. Every day, I think we see changes and we see disruption in the industry, and sometimes disruption can be a good thing, definitely dynamic. So as I kind of, think about that question, definitely we see the development of treatments for orphan and rare diseases, which is extremely exciting because, as I look back on my health plan days, a couple, 5, 6, 7 years ago, a lot of these medications that are being developed are for treating patients for which there were no treatments, right? Or solutions, or even now we're starting to see maybe alternatives. So that's very, very exciting because it's, very challenging, as everybody on this call knows, to tell somebody, geez, we know what's wrong with you, but we don't have any treatments for you. We also see the proliferation in the extreme and the rapid growth of health systems and hospital specialty pharmacies, which is, it's very exciting as well as we continue to try to focus on enhancing and capturing that patient journey and enhancing their experience.
Yeah, and I can just share too, from an accreditation perspective, we are seeing a lot of growth in new health system specialty pharmacies coming to seek accreditation for the first time. That's a big area of growth that makes perfect sense with what you just said. And I'm glad too, because we have a participant from a health system specialty pharmacy that'll talk to us in a little bit too.
Absolutely. And they're doing fabulous, fabulous things there as well.
Yeah.
We also see a focus on the role that technology plays in the management of that specialty pharmacy patient in digital patient engagement. And I think, COVID really did accelerate the acceptance of telehealth and, patients' willingness to communicate that way. But if we look back prior to COVID, specialty pharmacy was in a perfect position, right, when COVID hit, to continue to manage their patients remotely, because that's the business model that they operated under. So we really didn't see a lot of, interruptions or difficulty with that transition when the world shut down about 18 months ago. I can't believe that. So, and we're looking at the role that this, digital technology plays not only in enhancing the patient experience, but then also enhancing the clinical outcomes and the cost-effective outcomes, right? If you can get patients more engaged, you can speak to them the way that they want to be spoken to or communicated with, you have a better chance of getting them to be, compliant and adherent to their therapies. And then we also are seeing a focus on that last mile of the medication journey to the patient, right? There's so much investment in, before the medication even gets to the specialty pharmacy, right? With our manufacturers who bring these incredible treatments to market, and then, the payers deciding if they're going to cover them on the formulary and how they're going to cover them, establishing prior authorization criteria so we have the right drug for the right patient at the right time. Then it gets to the specialty pharmacy. How do we onboard the patient? How do we ensure that, they understand the medication, the side effects, how to manage, if something comes up, also addressing financial concerns, how do patients continue to afford these medications? And then, we ship the drug and we hope that it gets there. So now we see, the growth of organizations who are helping to ensure that that patient receives their medication on time as promised, right? You want to capture when they're excited to start treatment or at least engaged, and you don't want anything to prevent that and impede that compliance and adherence. And then we're also seeing a continued focus on just defining specialty pharmacy, right? We want to make sure that we have some of the regulatory and legislative protections that we need to protect our segment of pharmacy practice, then also developing specialty pharmacy specific performance metrics that help to demonstrate the role that specialty pharmacy plays in the delivery of healthcare, and then also for the purposes of measuring their performance. And then someday, right, I'm hoping that will translate into increased reimbursement for, all of the patient care management and product support services that are provided.
Mm-hmm. Yeah. And, that was a lot.
But there's so much going on, right? I always tell everybody wants to be in specialty pharmacy, which is great for me.
Absolutely. And you're right. There is so much going on, and there's a lot to stay on top of, right?
Right.
Yeah. So, and you just were mentioning about metrics and the different performance measures, and that's a part of our accreditation program. So we see a lot of different metrics that pharmacies use to measure their performance, depending on their disease state, depending on their praxis model, what makes sense to them. And we do spend a lot of time talking to organizations about not only how are you tracking this information, but then how are you using this information to demonstrate the value that you're providing to your patients.
Right.
And I think sometimes some pharmacies have done a great job of translating those metrics, those measurements, and those outcomes into, hey, here's our value and what that looks like. But others still could use some education on that. So that's great that that's an area of focus for your organization as well. So
we do at NASP, we do have a technology committee, right, that is focused on that, in addition to a clinical outcomes committee. And I think, where the challenges are, and we work very closely with NCPDP and PQA and of course, URAC and the other accreditors, but the challenge is how do we capture that data in a way that can be reported when a lot of it can be subjective, right? And it doesn't fit into a standard file format. So, our technology committee and our clinical outcomes committee work very closely together to try to figure out, if we were to move towards some type of standard measurement, what would that be? What does it look like? Does every pharmacy have the capability? What's required? How do we work with the manufacturers? How do we work with all of the stakeholders to ensure this is successful?
Yeah, and one of the biggest pieces there, right, is how do different pharmacies that might use different software or different platforms, how are they able to capture that information? And then one of the first things you mentioned was the growth in the digital space and how that is allowing pharmacies better access to patients and better access to get that kind of information from them. And if you're getting it in a digital way, then it may be easier to translate into an outcome that could be measurable. So, right. But again, and the growth has been so exponential, and to your point, COVID even, I think, increased that, right?
Right.
So we're not all at the same place where everyone's reporting the same thing or doing it the same way or in a data format that it's comparable yet, but it's really exciting to see all of these enhancements. So
absolutely.
Yeah, absolutely. Excellent. So thank you very much. And I think what we're going to do now, Sheila, we'll bring you back in a little bit, but I'd like to transition to the folks at Heritage Biologics and invite Amanda Walker and Brianna Kalekau to turn on their cameras. Hello.
Hey, Heather.
All right. Thank you again for joining us. So I want to kick things off with your team with, Heritage Biologics prides yourselves on looking at the patient experience. Can you talk about some of your organizational efforts that you have made in this area?
Absolutely. I can kick it off and just give a quick introduction to Heritage. And when we started about 6 years ago, our team came together and said, what have been some of the best practices from the previous organizations you've been with, and what are the things that we want to continue? So especially for myself, I am a nurse by background, came from the hospital setting, and I was also a nurse educator. And so I really saw that once these patients are sent home, they're really on their own. And so being totally new to the specialty pharmacy world, our leadership team kind of sat together and was like, how can we help coordinate and bridge that gap when a patient is either discharged from the hospital or when they get that new diagnosis that they haven't had. And so when originally back in 2015, we partnered and became a member of the Barrel Institute, which is a patient experience organization that started here in the United States. It's now grown to be an international organization that members are a part of. And it's really just a community of professionals who are focused on making that patient experience journey a smooth one, and figuring out how can we as healthcare providers all come together to help patients across their journey and navigating the complex healthcare world. So Heritage was the first pharmacy to really develop a formalized patient experience program. So we utilize the Barrel Institute's curriculum for patient experience, and several of our staff members have their certificate in patient experience leadership, but then really use that as a foundation to building our program. So for example, we've got patient experience navigators who are assigned to patients as soon as they're admitted to our service. And their job is really to help support that patient and surround them in layers of resource. So we say, our job is obviously to get their medication to them as their specialty pharmacy, but sometimes pharmacy can be the smallest part of what we do. From going and enrolling them in our patient portal and telehealth app, coordinating services with other healthcare providers, even, within one health system. Oftentimes, physicians in different specialties can't necessarily access the information from other areas of that health system. And so really just providing a way for information to be communicated across all lines, and then really giving patients a voice back in their care. I would say some other things our patient experience team does is helping patients connect to the community. So making sure that they are aware of the different organizations that are available to them. As Sheila was saying, COVID kind of projected all of us here into the technology space. And so, these support groups and different things that patients, especially if they've got new diagnoses, don't necessarily have access or knowledge of. So making sure that we get that to them.
Yeah, and I feel like technology is becoming a theme here, but I think you took a little bit of a different focus when you were talking about just the importance of connecting all of the different healthcare providers together from a technological perspective, so everybody can see what's going on with that patient. And I love the focus of the patient experience and making that a formal program. Because at the end of the day, that's what we're talking about, right? Is the patient and making sure that they have a positive experience. And we know if they don't, then they're not going to have a positive therapy experience as well. So I think that's great. Brianna, can you talk about some of the results that you've seen from your patient experience program?
Yes, definitely. You kind of teed it up for me, exactly what you said. So, with all the different initiatives that we have implemented throughout the years, we've really truly seen that a positive patient experience truly leads to positive patient outcomes. Patients really just want to know that they are being heard. And when it comes to living with a rare disease, they need to know that they really have someone in their corner that truly cares. As most of us are specialty pharmacy providers, we all really hold a very unique role, and patients place a tremendous amount of trust in us, whether you're the nurse, whether you're a pharmacist, whether you're on that patient experience team. They all just place a tremendous amount of trust in us. And so, while we may all feel like we're just doing our job every day, we can have, even just with small actions, have a profound, impact on patients. So as Amanda had kind of mentioned, our patient experience navigators, they have valuable, information that they gather from those patients on their recent, infusion visits. So they have regular touch points with them, touch base, see how did your infusion go, whether they're experiencing any side effects from the therapy, and then whether they have any outstanding needs that we might be able to assist with, whether it's specifically related to their therapy or something that's kind of going on in their world, whether that be at home or a community resource need that we might be able to assist with. And so some of the powerful recurring themes that we hear from our patients, I kind of pulled a couple of our survey comments. And just in recent ones, we've had the pharmacist is very thorough, never rushes on the phone with me. She's very knowledgeable, makes me feel confident in her care. The nurse is very thorough, professional, and friendly. Everything was explained fully and easy to understand. Heritage Biologics has been consistently so attentive to my medical journey, and also said has been the most attentive medical care I have ever received. I mean, I'm not sure how we could have asked for anything better there. So we truly take this, feedback and take it to heart, because we know that we're having a profound impact on patients. And then some that are not related to their therapy. One of our navigators was applauded for helping them with all the resources that they provided, without which they would have lost their house. So that seems, something that we didn't ever think we would be able to impact, but here we are, setting people up with community resources that really just bring, bring home the, the impact that we have as providers. So as part of our therapeutic management program, we gather our survey data, like I've mentioned. And so our net promoter scores, we ultimately, we want positive and not so positive feedback. If there's ever, a way that we can do better, we certainly would like to get that information. So, ultimately the clinician is going into a patient safe space. So we do home infusion therapy as our pharmacy. And so it's really important for us to make sure that interaction with the patient is positive. So if the nurse, maybe didn't connect well, or excuse me, if the patient didn't connect well with the nurse, that's really important for us to know, so that we can get a different nurse in there for the next time, so that, they have a good experience.
Excellent, excellent. So actually there's a lot of great chat going on. Amanda, your reference to the Barrel Institute got some folks excited, and we might have some referrals to that. I think as a result of that, I think that was answered in the chat. So the Barrel Institute, excellent.
Yeah, and we would love to have more pharmacies a part of that, because we are oftentimes the outsiders that are, when we get together for the different conferences and do a lot of education with the other providers in the healthcare community on really what is specialty pharmacy or pharmacy in general, and how we can really impact patients. So please do.
Excellent, excellent. So it sounds like you have obviously you have a very hands-on approach. Some of that feedback that you shared, Brianna, just overwhelming. Or what strategies do you use if you have a patient that just really doesn't want to be engaged in the clinical services that you're providing and those touch points? Do you have any strategies for how you try to genuinely get them engaged so that they will interact with you on another level?
Yeah, I might, as Amanda, she's overseen our patient experience department for several years, so I might let her answer that, because we certainly experience that. Every patient is different.
Yeah, and I think it's about meeting patients at where they are. So, all of us are probably very familiar. Patients have a variety of care that they want to experience. So some are very hands-on. They've got a lot of questions. They want to be communicating. Or almost over communicating, but then there are those patients who are more independent and more quiet. And so I think it's just really figuring out different techniques at being able to engage that patient. So here at Heritage, we do patient experience training on an ongoing basis, and we utilize, of course, as I said, the Barrel Institute's curriculum, but from different organizations such as Cleveland Clinic and other premier teaching institutions, but using things like service recovery, so and empathy, communication techniques, so hearing patients and being able to respond to them. I think it's also, we've had to be flexible. So if we talk about technology, we are at the day and age, especially with the younger generation, of people that don't want to talk on the phone, they only want to text. So figuring out how, as an organization, we can meet their needs, but still stay within guidelines and regulatory compliance that we have to maintain. So it's definitely a work in progress. And I think organizations have to be able to be flexible at really kind of going with the flow. And as things evolve and changes over the time, figuring out how we can best meet patient needs in that manner.
Absolutely. Meeting the patients where they are. That's going to give them the best experience, right?
Yeah.
Excellent. Well, Amanda and Brianna, thank you so much. We're going to call you back up later. But right now, I'd like to transition and welcome Tara Kelly from Vanderbilt University Medical Center to turn on her camera. Hi there.
Hello.
Excellent. Thanks again for joining us, Tara. So Vanderbilt University Medical Center is absolutely a leader in demonstrating improved patient outcomes and tracking patient outcomes. Can you talk about how this became a priority for your health center and talk about some of the ways that you've been tracking outcomes and using that to demonstrate your results?
Sure, absolutely. A little bit of history on the Vanderbilt Specialty Pharmacy. We really started our developing our integrated model back in 2012, and we saw that as a strategy to really reduce fragmentation in patient care delivery. We recognized pretty early on that we needed to track patient outcomes on specialty medications and make sure we were demonstrating the benefits of our integrated model. So we've really been prioritizing the growth and adding infrastructure to our outcomes research project since around 2016. And early on, this was a very grassroots effort. We formed an outcomes committee just from a group of our volunteer pharmacists. They met monthly, and gradually we've just been building up our infrastructure to further support the efforts. We've really began to put out some sound research and realized that we really needed to support these efforts with additional resources. From early on, we were able to tap into some of our institutional shared resources, and we still utilize those, such as our biostatistics department at Vanderbilt. And ultimately, the entire program has goals of just improving patient care delivery. We also want to show the value of our model and the integrated services we provide, and be able to also provide education and training, not only for our team, but for students and other residents. So what we really try to do with the outcomes committee and research efforts that we start performing is to really track the patient journey. And we do that from the pre-treatment evaluation onward throughout their entire treatment. So we want to follow our patient even through transitions of care. And we want to take our findings and the body of evidence that we have produced and continually evaluate the practice model and look for potential care gaps and opportunities for improvement as well. And recently our focus has shifted a lot towards using that body of research that we have developed and finding ways to improve our patient care and really impact our practice. And ultimately, we want to be able to identify risk factors for poor treatment outcomes and prevent these, and also be able to determine how to allocate the appropriate resources to patients. Some patients need a little bit more care and hand-holding than others. So really trying to use some of our findings to appropriately risk stratify these patients. And to go along the lines of what the benefits of tracking outcomes are, you can really kind of group that into three main categories. And ultimately, the number one reason we do all of the outcomes research and everything that we do is to improve patient care. You really have to be able to define and track patient outcomes in order to continually improve and make sure that your model is the one that's providing a good level of care for your patients. So we want to optimize the specialty medication therapy. Our goal is to try to mirror the high-touch clinical trial conditions as closely as possible in the real world, because we really want to be able to try to see the same patient outcomes in the real world as we're seeing in the trials that originally got the medications approved. We also want to contain costs and avoid waste. We do pre-treatment assessments that actually somewhat serve as a prior authorization prior to a prior authorization to make sure that only the appropriate patients are getting on treatment, and then ultimately improve patient access, their adherence, and then their experience as well. I know we've all talked a lot about focusing on the patient's experience. We also want to show the value of an integrated care model by demonstrating the positive patient outcomes that we are able to provide, and then increasing the efficiency and transparency of our care delivery. And of course, we always want to monitor and improve patient and provider satisfaction with our services. The other big thing we are trying to do with our outcomes program is really contribute to scientific literature and share our best practices. We all want to improve our understanding of the treatment outcomes and determine how to best manage our patients on all of these specialty therapies.
Yeah, excellent, excellent. So we're getting some great feedback and chatter, and folks want to learn more from you. So a couple of follow-ups. I know that you all have hosted an annual, really national conference on outcomes, which is really exciting, and puts you in the position of being a leader to get to convene folks, but also the ability to share more about what you've learned. Can you talk a little bit about that conference? And then also, like, have you published some of the results? Are there other places? Because we interact with a lot of pharmacies that might just be getting started on tracking outcomes. So, any place that you can point them to references where they can learn would be great.
Sure. We actually have an outcomes research website for the Vanderbilt Specialty Pharmacy, and I'll be glad to share the link to that. And that does have a complete bibliography of all of our published research. So that would be the best reference for everyone. We do have quite a bit that's already been published and some on the horizon as well. So when we did the Outcomes Summit, we really just wanted to bring institutions together to share best practices and teach everyone how to do outcomes research, because I think it's important for all specialty pharmacies to contribute to this body of work and evidence and ultimately use all of our findings to impact patient care.
Oh, that's fantastic. And that sounds like a really great resource. And I love when you were talking about the history of the Vanderbilt Specialty Pharmacy and how you guys got started down this path. It was a group of volunteer pharmacists who, were really motivated to move this forward. And so many great things happen from situations like that. So I think that's a great part of the story, and hopefully we're motivating some more pharmacists today to learn more about that, and to have that resource of the link that you mentioned is fantastic. What I'd like to do next is I'd like to invite Amanda and Brianna to join us again, and we're gonna transition just a little bit. We got you? All right, thanks. So as Sheila mentioned at the top of our discussion, one of the first things she mentioned is that there's a significant growth in approvals of orphan drugs, in many cases providing therapies for rare diseases that have never before had treatment options. Specialty pharmacies, such as yours, are of course well positioned to provide these medications along with all of those additional care services that patients with rare diseases need to make these potentially new and life-saving therapies successful. I know both of your pharmacy organizations do focus on providing medications to patients with rare diseases. And I'd like to give you both the opportunity to talk about, just a few minutes to talk about some of the best practices within your organizations when caring for rare disease patients. And Tara, since we're already chatting, I'm gonna let you go first, and then we'll hear from our friends at Heritage Biologics, excuse me.
Sure, that sounds great. So we all know that rare disease patients require an even more high-touch care model. And what we found is that when our patients can use our integrated specialty pharmacy, it really allows for coordination with the clinical team that's specializing in the treatment of the rare diseases and makes it very seamless. We have our embedded teams in the clinic, and that really allows for streamlined communication with prescribers throughout the entire journey, even pre-treatment considerations. It also allows for real-time interventions that can really impact adherence and persistence. There are questions that are asked on every monthly outbound call, and if any of those questions require a pharmacist intervention, that happens in real time, and that pharmacist and that team is located within the clinic beside the prescribers as well. And the adherence and persistence information is also readily available to those prescribers, so they can see how their patient's doing even in between their normal clinic visits. So we really feel that our model allows for personalized care for patients and extra support for their caregivers as well. And these patients and caregivers, they know the pharmacy team by name and face and can often reach them directly by phone anytime a need arises. And when we have access to dispense these drugs too, it gives our team a chance to really get familiar with the therapies and gain a really broad, extensive knowledge of support programs and resources that are available to these patients. So
that's great. It really is a different kind of practice of specialty pharmacy. Excellent, thank you. Amanda, would you like to talk a bit about Heritage Biologics' approach to rare disease patients?
Absolutely, and I think we resemble a lot of what Tara was sharing, and really individualizing that care is so important because these patients are so unique, and they've been on this journey and have often been not necessarily isolated, but they really haven't had those support and resources. So in addition to what Tara was saying, I'd say another big piece of how we have built our program is making sure our clinicians are educated and have the appropriate resources as well. So from an organizational standpoint, making sure that when these new diseases or these new drugs become available and are a part of our services, making sure that we are knowledgeable in those areas. So that includes reaching out to the different organizations or you know, a lot of times physicians that have done these studies or have been a part of the educational piece on that front, and making sure that we are really working in collaboration with them, to making sure that we develop appropriate monitoring tools, as Tara was saying again, with adherence, and figuring out where do these patients need to go and what is the ultimate goal. Helping our staff to be, you know, certified on top of just the initial education, you know, if that's available. And I think that also goes to helping our staff feel, you know, excited about coming to work and doing what they do. So not only is it enabling them to provide safe care to these patients, but also giving them some sort of ownership capabilities too, and excitement about the information that they have. Brianna, you want to hit on some other things that we do here at Heritage?
Yeah, so another kind of unique position we have, we feel so excited about, is being able to connect. We've talked about this a little bit already in the webinar, but connecting patients to community. So whether that's their local community or to their rare disease community. So, you know, in person, we, a couple of years ago, we got to host a walk, and it was called a rare experience walk. And so we had it open for patients that are from all different rare disease communities, and allowed them to come together, which was really exciting. And so different experiences like that we can kind of tee up for patients. And then also, of course, in the day of social media, that's a really powerful outlet for patients that have a rare disease. And so if a patient, I personally just saw a new patient that just started on therapy a couple weeks ago, and she had just been lined up with the local chapter for her disease. And we are familiar with that organization here in town. And so that was really exciting for me. And so she was really looking forward to going to some of the events and things like that. So just kind of making sure that patients are aware that those outlets exist, and that they you know, can really benefit from them, because just being able to talk to someone that's going through the exact same thing as you is just so powerful for patients. And so as a nurse, that's been really exciting for me to see that kind of come full circle.
Right, you know, absolutely. And I mean, even as we were developing a rare disease program, we as an organization learned so much about rare disease patients, and talking to the folks at NORD and learning about, you know, everything that they do and their interactions, and attending some of their meetings, and just, you know, hearing from them that the average rare disease patient, it's often 10 years till they get to diagnosis. So you get to diagnosis, there still may or may not be a treatment. Then there is a treatment. And then if the pharmacy can not only provide that treatment, but provide you with that community that, oh my gosh, I'm not the only person out there, and you can share. I mean, that just goes so above and beyond, and it's what they need. So it's great. And it's really wonderful to hear about how you guys are working on that. So perfect. Yet NORD is the National Organization of Rare Diseases. So sorry about that. All right, so at this point, I'd love to transition to a question and answer session. And to do that, we're gonna leave all of our panelists on camera and invite Sheila to show us her smiling face once again. Thank you. All right, so I'm gonna take a look at our question bank and see what we've got here to get started. The first one's for Sheila, since you have, you know, such a broad view of the specialty pharmacy space, and we were talking about specialty pharmacy data. And a lot of the data when we're working on metrics and measures seems to be operational, based on our operational transactions, and less on the patient. What have you seen? What progress have you seen around data on the patient and clinical outcomes, and how the industry is trying to move that forward across the board? Like the operational aspects are easier, right? So that's kind of the challenge, is how do we identify the clinical outcomes that can be measured across the board? Oh, hey, Sheila, I think you're still on mute.
Oh, I'm sorry, Heather.
Perfect. Now we hear you.
I think that's some of what we're trying to work at NASP in collaboration with not only NCPDP, right, but then also PQA. And I think that in order for this to really move forward, we have to get input more from the payers as well, because ultimately these are the folks who are going to tell us if what we're reporting on is important to them or not, right? Like, how does that? So I think we need, a lot more collaboration. We are trying at NASP to determine that. Like I said, a lot of it can be subjective. And so how do you capture a lot of, free form text and then be able to report back on that? And how do you, quantify that, right, on a scale of 1 to 100, based on somebody's outcome? So I think that it's going to definitely be multi-stakeholder collaboration that's going to move this forward and get everybody on board, because as you said, we'll all be then measuring different things, and it'll be very difficult to kind of compare apples to apples. And then at the end of the day, if we go through this entire exercise and it's not valuable for the folks paying for it, then it was really all for naught, right?
Right. And I think that is the crux of it. So the two, I think, really big things are, it's how do you capture that in a way that can be used across the board, right? But then all of the stakeholders, there are so many stakeholders when it comes to this, and the pharmacies might want to report one thing and the payers might want one thing and the manufacturers, and bringing us all together, I think that's key. And it's great that NASP is working that way with that approach to make sure that everybody is involved, because if only one group is involved, then you're not considering everybody else. It's not going to work. So,
right.
Awesome. Okay. For the pharmacies, so Amanda or Brianna or Tara, how do you minimize confusion for patients when both the specialty pharmacy as well as the manufacturer have patient coordination and navigation services? Because that can be like, who's calling me? Who's helping me get my medication? Amanda, I see you nodding, so I'm gonna go to you first, and then I'll let Tara respond as well. How does that sound?
That sounds great. I am laughing and nodding my head because this is a problem. I wouldn't say problem, but what we run into more and more this day and age. And so I think, again, education is key here. So a lot of times when these patients, especially if they are new to therapies, they don't necessarily understand how all of these stakeholders or different entities are going to come together, and really understanding what the entire piece looks like. So making sure that we educate them so they can be truly informed consumers, helping them to differentiate the, what our role is. And especially because we do try and go above and beyond and add in these different layers, we want to make it as simple as possible. So I think it's also, again, meeting the patient at where they are. If you've got a patient who is more independent or who wants to really be hands off, then it's us flexing the way that we, the services we're providing and the model of care that we're giving to them, so that we can help take away any of that confusion. And I think then it's also, what's important is our collaboration and communication to the physician then, so that they know exactly, what is going on, and so that it can be a seamless communication pattern that happens when that patient does go back for their follow-up visits, that everybody is on the same page and can kind of help decrease in that aspect.
Yeah, so critical. Tara, anything else to add?
Sure. Yeah, I would echo a lot of the things that Amanda said, and also say that, we work pretty closely with our manufacturer partners as well to see if there's anything that we can do to prevent duplication of services for patients. So if there are things that we can do on our end and provide to the hub versus having the patient have to do that, we try to coordinate that and make it as streamlined as possible. We also include in our initial counseling with patients, because our teams that are in these clinics are so familiar with the drugs and the programs that are available. We try to let the patient know who is going to be calling them. And, sometimes there's certain things that can't be left on voicemails just due to HIPAA and other things. So we will find out exactly what kind of message is going to be left for these patients and kind of pre-warn them that, hey, this is the program that's going to call you. If you get a message or a number you don't recognize, this may be how they introduce themselves, to really just give the patient the heads up of what's coming to, just trying to stay really transparent and inform the patient throughout the whole journey to make sure that they're able to participate in their care and make it as streamlined as possible.
Perfect. Thank you.
You're welcome.
All right. Another question for the pharmacies. So most patients do not like to answer phone calls. And we've talked about other digital ways of connecting with patients. Can you talk about what mechanisms have you found to be most successful as you've implemented different kinds of digital technology? Is it text messages? Is it emails? Is it another platform? Like, where are you getting the most feedback? Tara, do you want to go first, and then we can flip-flop?
And this is a challenge. We have developed ways for patients to get online and order their refills through our website. We're still working on some of those capabilities to enhance that patient experience. We do have the My Health at Vanderbilt communication portal that's connected to the Epic electronic medical record that they can request refills that way, and we can communicate in that fashion. Something newer that we've implemented is a chat bot on our website. So it allows us to securely chat with patients and order refills and communicate in those ways as well. So we're constantly looking for more ways to digitally connect with our patients and give them more options for connection other than just the phone calls that some patients love and some patients just don't have time for.
Got it. Anything to add, Amanda or Brianna?
I was just going to piggyback on that and just say, just having an open dialogue with the patient and asking them what their preference is, because some patients will kind of shut down a little bit and stop answering for a period of time, and then once we finally connect with them again, they say, well, I don't really like answering the phone. Okay, well, that's fine. We didn't know that. So what's the best way to get a hold of you? And then we can meet them where they are. But yeah, those are great areas that you have, Tara, on your organization. I think those are wonderful ideas.
Excellent. Excellent. Thank you. So, we do have more questions coming in, but I am at about the time where we need to start wrapping up. So the good news is we can capture all of your questions, and we can make sure to follow up with folks for any outstanding questions that we weren't able to get to today. So you can keep them coming, and we'll track them, and we'll make sure to get you a good response to all of those additional questions that have come in. But to wrap up, I would like to give each of our panelists an opportunity to just take a minute or two to share, like, we've talked about a lot of things today and a lot of different trends, right? And then a lot of things that we think might lead the way to better patient care in the future even. So what's your one big takeaway, or the one thing that you want our attendees here today to keep an eye out for in the next few years? And Sheila, I'll start with you.
So Heather, I must say, after I've been just reading through all of the questions and listening to the dialogue, I'm very, very excited at the, the importance that is being given to focusing on clinical outcomes, right? And documenting what it is that specialty pharmacy does and how they do it so well, and the value that it brings. And so regardless of you're an independent specialty pharmacy, health system, hospital specialty pharmacy, a PBM owns you, a PBM doesn't own you, you're a kind of a hybrid model. I think that we really all have to come together and start talking about outcomes. And so I think that we're going to see that right over the next couple of years. And, we definitely at NASP, we're kind of, all stakeholders, right? We welcome everybody again, because like I said, we want to make sure that we are inclusive and that, where we can, that, we're getting all of the insights and perspectives so that we can develop one solution. But I think what we're finding is it isn't going to be one solution, but then how do we make the solutions that make sense, right? To make sure that we're documenting outcomes and tracking outcomes and focused on outcomes that actually make sense and positively impact the total cost of care, not only the patient journey and the patient experience, right, but the limited amount of resources that we have to take care of all of these patients. And as we start to continue to see more and more of these incredible therapies for rare and orphan diseases and gene therapy, how are we going to afford this, right? What can we do here? So, I'm really excited to see everybody come together again with the patient at the center of what we're doing.
Mm-hmm. Excellent. Thank you so much. Heritage Biologics, same question. One big takeaway that you want folks to keep an eye out for the next few years.
Yeah, I think echoing off of what Sheila stated, I think it's coming together. It's collaborating as an industry. There's so much power. Everybody is doing such great work. And I think the important thing here is figuring out how we can all come together to not only share that data, but so that we can continue providing value to all stakeholders. So, patient care is first and foremost, but it is figuring out where each of these stakeholders is and what their needs are. And then just being transparent and sharing the data. So I think, utilizing organizations such as the accreditation bodies and national organizations such as NASP and some of these other, for us, home infusion specialty pharmacy, I think it's just learning from one another and figuring out how can we all elevate to the next level so that we can, first and foremost, share data and then get patients to those better outcomes while also being able to impact the financial side for the payers and then provide value to these manufacturers and do it all in real time so that we can be on the same page helping patients through their journey.
Absolutely. Absolutely. Thank you. And you want to round us out, Tara? What should we keep an eye out for in the next few years?
I think I echo a lot of what everyone's already said, but I think just the importance of personalizing and individualizing patient care. I think patients are becoming more and more involved in their care, which is a great thing. I think they're behaving more like consumers, but I think that's going to continue to increase demand for convenience and transparency into their experience for them. Healthcare is so very complicated, especially for patients with conditions that require specialty therapies. So I really think it's our responsibility to try to simplify that as much as possible for our patients and provide them with the best experience.
Totally agree. Totally agree. Thank you all again so much for joining us today and for sharing your expertise with us. And I want to thank all of our participants today. Again, I love to see out of the corner of my eye the chat box going fast and furiously, and we're looking forward to connecting with some of the folks in the event that we didn't get to answer all of your questions today. But I want to wrap up by just reminding everyone that next week, URAC is releasing a white paper, Specialty Pharmacy, Succeeding in a Shifting Landscape. The speakers you heard on this webinar today were all contributors to this paper, and there were a few others as well. And because you joined us here today, you'll be one of the first people to see the paper. You'll actually have it in your inboxes tomorrow versus the public release next week. Again, the paper covers a lot of the topics that we talked about today, including the important role of specialty pharmacies, the challenges presented because patients are faced by these the unique natures of the therapies they dispense. We talk about opportunities, innovation, especially when treating patients with rare disease. So we certainly hope that you'll read the paper when you get a minute, share your thoughts with the URAC team, and we will put our contact information in the chat box, and you should see it posted here as well. Thank you, Lisa. And with that, again, I'd just like to thank everyone for joining us today. Have a great rest of your afternoon and take care.